Doctors around the country are fielding questions from pregnant patients on whether they can safely take the pain reliever Tylenol. It's because President Trump linked Tylenol use to autism in children, despite years of evidence that the medication is safe. He told pregnant mothers it might be better to, quote, tough it out. The president reiterated his warning online yesterday, again, telling pregnant women to not take Tylenol unless absolutely necessary and urging parents to not give it to their children. The message from the FDA, well, it was a little more muted. While it said studies have found a possible link between autism and acetaminophen, which is branded as Tylenol, it added that that has not yet been determined. And acetaminophen is the only over-the-counter drug approved to treat fevers during pregnancy. Dr. Harry Hyman is a clinical professor in the School of Public Health at Georgia State University and a former family physician. You spent many years in family practice. You're with me now, so give me your initial thoughts on everything that happened last week in relation to Tylenol. I kind of saw you shaking your head a little bit.
Yeah. Thanks for bringing up this issue. I mean, clearly there was a time where patients and consumers could rely on federal health agencies for information to help guide their decisions. Unfortunately, that's not the case anymore. We really can't rely on information coming out of federal agencies. And I think this is a prime example. I think the Tylenol, as the FDA walked it back, is still the safest and most effective treatment for pain and fever during pregnancy. There have been numerous studies looking at Tylenol, and some show a positive association, some show no association, some show a negative association with Tylenol use and neurodevelopmental disabilities, which includes autism. But none have shown Tylenol as a cause, let alone the cause for autism. We actually know that high fever during the first trimester of pregnancy is a serious cause for congenital abnormalities and neurodevelopmental disabilities. So the risk for taking Tylenol to treat the fever is insignificant relative to the importance of treating the fever.
I mean, I just can't imagine what kind of conversations people are having with their doctors right now. These are, especially when you're pregnant, it's such a vulnerable time. I imagine some people come into doctors' offices very scared. I mean, what would you be telling your patients right now if you were still seeing patients?
What I would be telling my patients right now is that Tylenol still remains the safest and most effective treatment for fever and pain during pregnancy. That you want to limit your exposure to any medications or toxic substances like, say, alcohol or other things during pregnancy. Less is better than more. But Tylenol is still the most appropriate. And because we can't rely on federal agencies today, they should rely on their physicians and others that have the understanding and expertise to guide them.
And this idea that women have to tough it out, I mean, it kind of puts it back on the woman again.
Well, I think we have to understand the source. I'll leave it at that.
Okay, all right. Well, let's talk about mifepristone, also an important drug. The FDA approved this back in 2000, and it's long been cleared to end a pregnancy through 10 weeks of gestation. It's been long proved to be safe and effective, on par. Studies showed safety is on par with those common over-the-counter drugs like ibuprofen. What do you think about this idea that the FDA is reviewing evidence that about the safety and effectiveness of this drug?
Well, I think it leads one to ask the question, why would the FDA decide now to start reviewing this medication? Is there any new evidence? Is there a reason for concern? And the short answer to that question is no. There is no new evidence, but there are political drivers of decisions like that. And unfortunately, we've seen an increasing politicization of what's going on in terms of our federal health agencies. And so we know that the medication is safe and effective. There was a recent court case thrown out. And this is being driven by 21 Republican attorney generals from states that have taken other actions to restrict access to reproductive health care. I think you need to understand that in the context. I think what is, for me, even more disturbing than this is the fact that the Secretary of HHS has essentially demolished the very federal public health agencies, the very units within our federal health agencies that are responsible for looking at issues like this. The Division of Reproductive Health doesn't exist at CDC anymore. Their mission and their scope included everything from contraceptive services to safe pregnancies. There was something called PRAMS that looked at pregnancy outcomes. It was a surveillance system. That's been deconstructed. So, I think not only is it concerning to me as a public health expert that they're raising concerns about a drug that has, as you pointed out, 25 years of safety and efficacy, but they're doing that in the context of deconstructing the very expertise at our health agencies that looks at issues like this.
Okay. Dr. Hyman, thank you so much for all of that analysis. We appreciate it.
Thank you.